So, which women should avoid taking Mounjaro? I mean, Mounjaro has been a godsend for many women. As a woman, you've tried all sorts in terms of losing weight. You've tried, tablets like Orlistat. Maybe you've tried other injections like Ozempic or Wegovy. You've adopted, the lifestyle approach with the exercise and the diet. Nothing has worked, and along comes Mounjaro. However, what people don't tell you is that there are only certain women that cannot take Mounjaro. But first of all, let's talk about which women can take Mounjaro. If you have a BMI of 30 or over, or you have a BMI of between 27 to 30, and you have other comorbid conditions such as type 2 diabetes, high blood pressure, high cholesterol, sleep apnea, heart diseases, then you will fulfill the criteria in the UK for being prescribed Mounjaro injections. However, if you are a woman who does not want to get pregnant, you should avoid taking Mounjaro because Mounjaro will increase your chances of pregnancy. Now, you could be a woman who's got polycystic ovarian syndrome, which is a condition where you have irregular periods. So you might not have had periods for maybe the last 3 months, and you're thinking, oh, I cannot get pregnant because I've got polycystic ovarian syndrome. Guess what? You take Mounjaro, Mounjaro is going to increase your insulin sensitivity because that's what Mounjaro does. Mounjaro was originally used to treat type 2 diabetes for that very reason. It decreases insulin resistance and increases insulin sensitivity, which is one of the reasons why, if you've got polycystic ovarian syndrome, you've been unable to get pregnant. Also, you might be taking the oral contraceptive pill, which again is the pill to avoid pregnancy, and you're thinking, I'm on the oral contraceptive pill, I cannot get pregnant. Hey ho, you can get pregnant on the oral contraceptive pill. So once you start taking the Mounjaro dose, you should either switch to a non-barrier contraception method, such as using condoms, or using a non-oral contraceptive method, whether it's injections, the implants, the patch, the IUD coil, 4 weeks after starting the dose and 4 weeks after change of every dose. So you should take this for 4 weeks after starting the dose of Mounjaro and for 4 weeks after changing every dose. Remember that, women. Remember that advice because if you do get pregnant while taking the oral contraceptive pill, that means you've not been counseled properly on the pros and cons of taking Mounjaro. Also, women should avoid taking Mounjaro if you've got conditions such as a type of thyroid cancer called medullary thyroid cancer, type 1 diabetes, which increases your risk of having conditions such as gastroparesis, where you have slowing down of food going through the stomach due to damage to the nerve supplying the stomach, pancreatitis, and if you've got an acute kidney injury, which could be caused by a urine infection, for example, or some form of trauma. So, women, if you have any of these health conditions, avoid taking Mounjaro. Now, in terms of dosing for Mounjaro, you usually start with 2.5 milligram dose. You take that for 4 weeks. If everything is all good, then you now increase to 5 milligram dose, which you take for another 4 weeks. Therefore, you can now increase the dose by 2.5 milligrams every 4 weeks. So 4 weeks later, you can increase to 7.5 milligrams. 4 weeks later, 10 milligram dose of Mounjaro. And then we have what we call a maintenance dose, where if you feel that you're achieving weight loss of the 10 milligrams, you can stay on 10 milligrams, or you can increase again to 12.5 milligrams up to a maximum of 15 milligrams. And this is what we call the maintenance dose, where you stay on these doses for the long term. It has been shown that you can lose up to 20% of your body weight within 72 weeks of taking Mounjaro. And even some women have said they've lost 20% of the body weight under 6 months, which is remarkable because 5% of body weight loss is what is expected to be achieved. Now, in terms of side effects of Mounjaro, we're talking about the usual side effects because Mounjaro mimics your gut hormones. So expect side effects such as nausea, vomiting, diarrhea, constipation. But you could also have other side effects such as skin reaction around the injection site. You might notice that you're losing hair. If you're type 2 diabetes, you're taking other types of medications, you might notice that your blood sugar is very low, which can cause hypoglycemia where you feel faint and dizzy. And also watch out for the rarer side effects such as pancreatitis and gallstones. Look for symptoms of, again, abdominal pain, nausea, vomiting, paleness of your skin. These are the first symptoms you expect with pancreatitis and gallstones, in addition to fever. If you've got an infection of your gallbladder or your pancreas, you're having a fast heart rate, then you need to see your doctor straight away. Do remember that Mounjaro is an injection, so it comes as a pre-filled injection pen. It's usually applied in your upper arm, in your stomach, or under your thigh. Your nurse or your doctor will train you on the use of Mounjaro. They would review you for the first 5 months to check your compliance. Then you have a 6 month review to see if you're happy with the dose, if you want to continue with the medication. Then after that, you get annual reviews if everything goes to plan. I hope you've understood this video on which women can take and which women should avoid taking Mounjaro. If you have any questions or comments, please drop them below.